So neurodegenerative conditions, they're typically progressive, and that's what can be a little bit challenging to determine the influence on what's going on. So oftentimes, if you're seeing a patient and you've been able to see them, over the course of many years, then you may actually be able to plant out some of that trajectory. In other words, even if someone falls within the normal spectrum of a particular marker or metric, seeing those changes, maybe they started at the high end of normal, now they're at the low end of normal, that might be a significant enough of a change. Other challenges are age-related influences. So typically as people age, they tend to walk a little bit slower. So definitely looking at speed. So even older adults really should be walking close to 2.5, and really a goal would be to get them up to 3 miles per hour. Multiple reasons why someone may not walk as fast as they used to. Also looking at fall risks profiles and making sure it's not because of loss of balance and things like that. But being able to tease out some of these abnormalities have to do with, similar to what we discussed in the motor control strategies of mild traumatic brain injury, is again losing that capacity to have a normal pattern in something that otherwise someone's been doing their entire life. So we may see some changes in symmetry patterns. Certainly there's going to be some slowing, especially if it is related to the aging process. But if it's more significant, that may be also indicative of a neurodegenerative condition. More so is looking at these abnormalities in some of the strategies. So for example, even if they're walking at a what's considered to be a normal pace, it may be because they're trying to spend less time in ground contact and generate more through the propulsion and into the swing phase, or vice versa. So not having normal percentages in that walking profile. In other words, in their mind, they're still trying to walk as fast as they used to walk, but because they don't have the capacity to either move through the contact phase as quickly as they used to, their strategy could be to go through the propulsion and use more of a strategy in plantar flexors and move into that swing phase more rapidly to sort of compensate for that. That's also a strategy that we tend to see in the older adult population, is lower hip flexor activation and compensatory strategies in plantar flexion. So keep an eye out for that. But look at widening, even if their gait pattern is normal through the gait line or the pronosupination process. What you do see is a widening of the standard deviation. They're starting to lose that ability for that motor control, and least of which, even if they're more sedentary, then walking in general is going to be a little bit more of a challenge, but at least gives us some indication. But there are relationships to being more sedentary, walking slower, all those things, especially with the older adult population. And as you can see here in the breakdown of the walking profile, seeing, some of the compensatory strategies, when they're spending too much time in a stride because there's increase in contact time, they're trying to compensate for that in the swing phase. So their swing duration is really, really short, and vice versa. So overall, just looking for changes in symmetry, changes in speed, and just deviations in a lot of those motor control strategies.